About 19,000 young men and women who have been working as community health nurses in deprived and rural areas of the country for the past 2 years under the Youth in Health policy by the Youth Employment Agency will be granted financial support as they exit the program in August. The Youth Employment Agency is collaborating with the Ministry of Health and Ghana Health Service, and today they launched an exit strategy committed to promote economic empowerment and growth.
The CHU and e-health program is designed to engage beneficiaries for a 2-year period. Thus, it is not meant to directly provide permanent employment to the beneficiaries. Participating in these programs provides several benefits and opportunities, including work experience, skills development, community engagement strategies, mentorship, monthly financial allowances, which can help the beneficiaries transition into the world of work, higher education, or other pursuits. Despite the advantages, however, the transition from the YEA model can often be challenging for many beneficiaries and sometimes resulting in the beneficiary not finding jobs, a situation that could best be described as recycling of unemployment. Apart from the burden placed on the beneficiaries of YEA models, including CHU and e-health, the exit of these beneficiaries is a loss of valuable resources to the health sector, given the resources expended on their training and skills development. The rationale for the CHU exit strategy is to help beneficiaries on the CHU and e-health models transition into sustainable employment or advanced education. It seeks to support them to pursue higher education or develop entrepreneurship skills that will eventually lead them to sustainable jobs.
I'm really excited about it because at first we've been thinking of you spend 2 years, then after that, what next? But since now they've really brought an exit plan for us, I mean, we are really excited about it. And we thank God that they are bringing this, and we hope they really do what they are saying.
Would you take chance for the scholarship or
yes.
the entrepreneurial skills? Which one are you hoping to?
Okay, I'll really take the chance for the scholarship.
To further?
Yeah, to further, because I'm really interested in the nursing more than anything.
Which one are you looking to go for, the entrepreneurial skill or the scholarship to further into nursing?
As for me, I'm interested in the community nursing, but I thank God for that.
Yeah, I'm very excited for the assurance they have given to us, because we were all wondering what next after this program. But since they have given us a rest assurance that there is something ahead of us after we finish, then we are thankful for everything that they are going to do for us.
So that's not all. This seemed to be a very big conversation. And joining me in the studio is Chris Arthur, who is Acting Director of the Monitoring and Evaluation of the YEA, and also Chief Nathaniel Ebo Nsako is Country Director of the Millennium Promise Alliance, an NGO that is collaborating with the YEA to achieve all of this. Good afternoon, gentlemen.
Good afternoon.
We're grateful for your time. Let me start with Country Director from YEA, and Ms. Atta, you seek to empower these health workers as they exit the program. I mean, what is the strategy like? How are you going to be empowering these people?
Thank you. Let me narrow my argument to the perspective of YEA. We came to meet this 19 beneficiaries on our payroll as CHU workers, that is community health workers. After 2 years, by law, they have to exit. That is, they have to go from the YEA program. It has been the culture that after 2 years, these young men and women will be laid off without a clear exit plan where they are going. So they have become like a culture of recycling unemployment. So with the new management of YEA, we saw the need to collaborate with existing agencies, and this area has to do with the Ghana Health Service and the Ministry of Health, together with the Millennium Promise Alliance, to develop a strategy a plan that will give them a sustainable employment.
Right.
That is to say, after this arrangement with us, we are encouraging them and also supporting them to enter into the main nurses training schools. After their completion, they become a trained, qualified nurses working in their communities. So that is the whole idea of the exit plan. So by giving this plan, we are ending this kind of why is just 2 years. After 2 years, where do you go?
Okay.
We are ending that kind of mentality.
And actually empowering
them to have a very good and fine job opportunity. And it is not by force, it's not by coercing them that whether you like it or not, go into nursing training college. That is why we say we are encouraging them. And in collaboration with all the agencies that I have mentioned, the plan is that those who qualified and want to serve the country through nursing will have to go buy the form. We will take them through the roadmap, interview them, we conduct up-to-date tests for them. Those who so pass through will be given opportunity to go through nursing. After that, they become a qualified and fully fresh nurses to help the health sector.
Okay, Chief Nsako, you are with the Millennium Promise Alliance. What role are you playing in all of this?
Thank you very much. So the idea of making sure that these community health workers transition smoothly into the mainstream job market, creating sustainable jobs for them, is something that's very dear to our heart, and we're very happy when they made it known to us that it's something that is mandatory by their ally to get it done. Our role is very simple. We are more or less like the master brains behind the community health worker model globally. It's not only Ghana. There are a lot of other countries where we facilitate the community health workers model. And in Ghana, we played a very pivotal role in getting it established, the roadmap leading to the establishment of it. And so we equally are more or less committed to making sure that we create a sustainable exit channel that allows for these community health workers to be well institutionally trained and established so that they enter into the mainstream job market. And so our role is to facilitate the whole process, making sure that we help coordinate the activities and help them to develop the strategic documents which will lead to the smooth exiting of these community health workers. And like he rightly mentioned, some will be going into nursing. We identified so many avenues where these community health workers could actually be trained. They have acquired a lot of skills on the job, working in the health sector. And the health sector is not only nurses that are there. We have disease control officers, we have health information officers, we have oral health officers, and so many others. So we have pharmacy assistants and all. So we were able to do what we call creation of a repository of the various health gaps or opportunities that exist where we could get these people into training to become professionals in the health sector. Right. So that is the role we played in trying to map out all the various gaps that exist, the potential opportunities, so that we could help facilitate the stakeholder engagements and all of it, leading to the development of this exit document that was launched today.
Right. So, Ms. Atta, you talked about how you want to support the people who are interested. You're not forcing anybody to enter into it. But you know that training doesn't come only with tuition. It comes with upkeep, equipment for training and all of that. And of course, with the nurses, they also have what we call the periodic practicals and all of that. So what does this package involve? What does it comprise in the event that the health workers qualify to be in the schools you're talking about?
Yeah, right. The beneficiaries, by way of practice, every month we deduct something from their monthly allowances. That is to say, we take 50 Ghana cedis, 5 cedis go to their insurance, and 45 go to their welfare. You know, we have calculated the amount. We'll be giving back this to them that will help them. Those who will be finding difficult even to buy the form, this can just keep them. We are also in talk with Ghana Scholarship Fund Secretariat to augment the letter that we will do to give scholarship to those who may find difficulty even to buy forms or even giving them some kind of upkeep. Again, the good news is that nurses allowance is back. So this time you may not necessarily have to go through financial challenges before you can complete nurses training. That is a way of helping them. Now, how would they get admission at the first place? They, as Chief said, have gone through practical training with the Ghana Health Service. They have gone through 2 years. From the perspective of Ghana Health Service, it is even dangerous to lay them off without telling them where they are going. Some of them will be establishing their own connect at the communities and will become dangerous for our health issue. So it is very important that the nurses and midwife council and then also the training schools giving the opportunity for them. So if they go through all the process with YEA, they will not be subjected to kind of rigid scrutiny as probably they will do with the first timers. These have gone through some series of skills training. So their admission is somehow assured, those who want to and those who qualified. Right. So that is the whole package. Okay. By doing this, we are also giving others opportunity to enter into the model, because we cannot keep the 19,000 and still having the financial ability to recruit more. Okay. So when these are off, then the new people are also coming. Mm-hmm. And they are not going just off, they are entering into their desired profession that they want to, as nursing. Great.
I mean, as it stands now, we all know that there's a backlog of nurses who are looking for the opportunity to be posted to various health facilities to serve, which is not happening. Don't you think that this will create more, I mean, it will increase the numbers, because if they're trained, where do they go from there after the training?
To add to what we are doing, the ministry that the Ghana Health Service and Ministry of Health and YEA and other agencies are collaborating with another package for the already trained nurses. Those are not the people that we are talking about. Okay. These trained nurses will be taken care of as soon as possible. Okay. And it is on the way of launching. By the close of the month, probably we will launch how these trained nurses will also be absorbed
into the system. Give us a clue. I mean, what's the plan like?
I think Chief will give details to that.
So Chief, tell us, what's the plan like?
Thank you very much. I think, like he rightly said, you know, we're very privileged to have a president who is interested in the creation of, I mean, a healthy population. And he came up with this free senior high school. And so we institutionalized what we call, the Ghana Health Service has actually institutionalized what we call the free medical screening for all the SHS, which was just recently done. So through that, we realized that we needed to create what we call the infirmaries, the sick bays across the country. And these sick bays, in some schools, they do have it. And the people who man such sick bays sometimes are people who are out of the profession for a very long time, so they are cake with time. And so the whole idea, like Chris rightly said, is to bring these unemployed nurses, you know, under a group so that they could be posted to these senior high schools to man the sick bays and also to be attached to, I mean, close health facilities so that they could be mentored by those who are well experienced in the area of healthcare delivery at the district level. And this is very far advanced because we have been working with the YEA, my agency, and the Ghana Health Service and the Ministry of Health, as well as the Nurses and Midwifery Council, and we have developed the entire roadmap We've developed the training material, that is the manual that is needed, and we have actually done all that there is to be done. We are now at the final stages where we are fine-tuning the rough edges, and then, like he said, we're going to launch it, and we are going to engage there are about 10,000 of these unemployed. They actually don't even number up to 10,000. But from the Nurses and Midwifery Council, the numbers that they gave us, per those who have had the training, we can take about 10,000 of them to go into this model we call the NMAP, Expanded Nurses and Midwifery Attachment Program. That's what we call. And so this is actually well done. I mean, we're just fine-tuning them, and very soon we're going to launch it.
So is it going to be just an attachment, like I think they're just going to do internship over there, or what kind of attachment are you talking about? Or they're going to be employed?
Yeah,
is it full employment?
So this one is not a full employment. You know, the gap is that because of some conditionalities, they couldn't get the clearance for this number, you know, to be absorbed into the mainstream. So we have like 2 years backlog of these unemployed nurses. So we want to create a bridge that will help us to clear off that backlog. And that bridge is the 2-year engagement of these cohorts who have graduated and yet were not absorbed into the mainstream. So in the process of their engagement through this NMAP program, once the clearance comes, it's just a matter of them transitioning into the mainstream. They are already attached to the health service. So they are not going to sit at home, and then, you know, you can grow rusty. Once you have been trained and you don't practice for about 2 years, you can grow rusty and want to engage them. So some of them have done some attachment. Some of them have done internship. But we are saying this is an expanded and extended, you know, attachment, so that it lets you know that, yes, we care about you. We would want you to practice so that you don't grow rusty. You don't want you to just while away the time by staying home. We just want to engage within these 2 years to, support our health system and the schools. Because you just recently heard of this Kumaka issue. And I'm sure the Ghana Health Service was very fast. And in the process of doing the mapping, that is why we're able to unravel the situation that came in the news. Okay,
it wasn't actually Kumaka alone. Other schools also had their share. But how long are they supposed to be attached until they are absorbed into mainstream?
We have done it, we've designed it for 2 years. For 2 years. But we've done it in such a way that after 1 year, it's renewable for the next year, knowing very well that it's likely that within that 1 year, they may receive the clearance.
They may receive.
You're not sure. We're not too sure yet. Because, some clearances just came, and some of them were absorbed by the ministry and the Ghana Health Service. So we're likely to receive some clearance very soon. So as soon as that comes, it's just a matter of formalizing it and listing them into the mainstream health sector. And so it's 2 years, but 1 year renewable.
So after 1 year you renew, but after the 2 years, if you're still not absorbed into mainstream, it means
it's in a very unlikely event that, because that one has come to stay. The school infirmaries that we seek to post them, it has come to stay. It's something that is we want to establish properly managed school infirmaries affiliated to close by health facilities. It's something that has come to stay. And so it's not like a one-off thing. And so once you are posted there, you can be there and renewable. So if you are not absorbed now, you'll be absorbed very soon. And so until you are absorbed, you are on. And so I'm making the point that after you have a duration of 2 years. I mean, for each person, that's what you enjoy. So after 2 years, if you're still not absorbed, do you still have the opportunity to renew? Exactly, you are still there. You'll still be maintained as an attachee to the, but it's in the very most unlikely event that you will not be absorbed, because these are people who have been trained formally, and they were waiting. Your PIN number and all of that are the things that we are going to use to enroll you onto this program. And therefore, we know very for sure that you need that clearance. So once you are on this program, we are working on your clearance as well. So
you earlier mentioned that this arrangements can only take about 10,000 of the nurses. What happens to the rest?
Like I told you, I think the numbers, we were working with the numbers, those that were unemployed. We needed even more because looking at the sick base, and now very soon it will be announced that we're going to do screening for about 1.2 million basic peoples as well.
Okay.
And so we need more hands.
More hands.
Okay, we need more hands. And so the number that we are looking for is very huge, and not just the 10,000. But the 10,000, like I'm mentioning, is the backlog that we received from the HR department of the Ministry of Health as the people who were trained and were waiting for clearance. And so we would want
I thought the number was more than that.
We want to start with what we have been provided with. We want to start with that number, and so we move it from there.
It also brings back the conversation of sustainability. How sustainable is this program? And that's what I'm putting to you, Mr. Arthur.
For the Chew Exit Plan?
Yes.
Yes, it has come to stay. That is why we have launched it. Now we have documents that we can refer to. You know, in our laws, you are supposed to provide exit plan for your beneficiaries after 2 years. So by law, we are only implementing what is in the law, and we are not at liberty to decide where and when. It is by law. We need to ensure that after 2 years, and this is not for only the CHIU, all the beneficiaries on our various models, the CTES, that is community teaching assistants, fire service, police personnel. Just this morning, Deputy Minister for Education called me to have discussion as to how we are going to see the community teachers also. So it is something that we are bound by law to ensure that we make a provision for them if they so wish to enter into the desired profession that they want to.
Okay.
So it is very sustainable and also a job security opportunity for them.
Well, Chief, there have been concerns of how nurses in general, you know, conduct themselves out there after they've been posted, and again how some of them are negligent in, you know, ensuring that patients are taken care of. Do you have a monitoring mechanism so that when these people are attached in this attachment arrangement you're talking about, you monitor what kind of services they're rendering, what their performance are, and if there are sanctions that should be given to some of them, or even if some of them do not qualify, if they have to be withdrawn? Do you have some arrangement to this effect?
Yes, we do. In fact, we actually created what we call some model in terms of even the training that we're going to give to these ones. In spite of the fact that they have received formal training, we are going to give them top-up training or orientation, so to speak. And we also have made provisions to monitor them electronically, so that we have what we call pay for performance. So it's not like once you are on, you are going to just receive your salary. We want to use this as a bedrock to bring some sort of quote-unquote some discipline and some sanity. Because, I mean, just recently the council chair for the Ghana Health Service actually mentioned that it's a major headache, and it is something that they are looking at to finding solutions to. And we would want to start with these ones. Okay. Once they are yet to come out into the mainstream to practice, we want to groom them and prepare their minds in such a way that they communicate well, they understand the ethics of the practice, and make sure that they adhere to all the measures and know that we are on them and we are monitoring. So once you go off, obviously you'll be sanctioned and you'll be brought in check. So we have a very robust, system in place to monitor, and we are working very closely with the Youth Employment Agency and the Ghana Health Service to make sure that the electronic system by which we are monitoring the people and how they clock in and make sure whatever they do, the routine work they do and all of that, we receive feedback from the field, from the office, from the schools, because it's a multi-sectorial sort of thing that we are establishing with the Ghana Education Service, with the School Health Program, as well as the Ghana Health Service, the Youth Employment Agency, and our organization. So it's not like you are just under YEA or under that, but we are all monitoring from different angles, and we all have our indicators and certain things that we want you to meet. Okay. So all of these things are very strictly enshrined in the document that we have produced for the NMAP.
Chris, once these people are done with the training, is it automatic that when you graduate today, the next week you are going to be attached, or how long are they supposed to be waiting for them to get this kind of things?
Yes, so you can see the link. The linkage is that after you finish your training, then until probably your financial clearance is made, you just usher into this.
The attachment. And that's what I'm saying, that is it automatic?
In
that
fact,
once you're done, you're just going to be attached whilst you wait for your posting, or you have to wait for some period before you are attached?
It depends. Those who will be doing diploma and above program, they will by law have to do their national service.
Before.
So soon after national service, then they will enter into this arrangement. Those who will be doing the diploma programs and those things, as soon as they are done, everything, then we just take them through this arrangement. So the issue of finishing school and becoming like sitting at home waiting, the problem is very...
be a thing of the past.
Yes, we don't need to experience that thing that you have finished school and you are still waiting home for lack of funds. We need to at least do something for you to give back to what you have been given.
Well, it sounds like some good news this afternoon. The issue of nurses, getting trained and sitting home doing nothing will be a thing of the past. That's according to Chris Arthur, who is the Monitoring and Evaluation Director, Acting Director at the YEA, not from me. So we'll be monitoring from afar and ensuring that the right thing is done. Many thanks, gentlemen, for coming to the studio.
Thank you very much.
We're truly grateful. And we're still on the pulse.